Blackman.
Thank you, Mr Deputy Speaker, and a pleasure to follow the honourable member for Central Ayrshire, who brings her knowledge of the medical profession to this House on every occasion. I agreed with almost everything she had to say, apart from the last comment. I rise, Mr Deputy Speaker, and declare my interest as Chairman of the All-Party Parliamentary Group on Smoking and Health. And I support all the amendments tabled in the name of the honourable member for the City of Durham, New Clause 2 and on. These amendments are a comprehensive set of proposals which are complementary and can be picked up by the government. It's fair to say that during the committee stage of the bill, these amendments were tabled in a different form. They were discussed, debated upon, and I think ministers said, we'll take them away and have a further look. We've refined the amendments on the basis of the debate in committee, strengthened them and brought them back again. And it's fair to say that they address the loopholes that exist in the current legislation. They strengthen regulation of tobacco products still further and provide funding for tobacco control measures which are so desperately needed if we're to deliver the government's smoke-free 2030 ambition. Now, we had a debate last week in Westminster Hall, an excellent debate, which the new Public Health Minister answered the debate. It's fair to say from across the chamber, we were posing questions to the government about when we would see the long-promised tobacco control plan, which is due to be delivered, presumably, by December the 31st this year. But we got no firm commitment on when we will actually see it. And I'd like, obviously, my honourable friend, the Minister, to bring that forward as soon as possible, because then we can measure what is going to happen. The problem that we have on tobacco control right now is that if we do nothing and none of these measures are introduced, the risk is, as the honourable member for the City of Durham quite rightly articulated, we will miss this target by 7 years. And for those people on low incomes and in deprived circumstances, it'll be 14 years. And what we have to consider is how many people will die of smoking-related diseases as a direct result of the failure of the government to achieve the smoke-free 2030 ambition. So it's quite clear we need to take further action. And I would urge my honourable friend on the front bench, who I know is a doughty campaigner for public health, will make sure that we deliver on the proposals that we have. My main focus is obviously on the amendments to provide funding for tobacco control, because after all, we all accept that not only can we implement measures, but we've got to fund them somehow. And I think that's got to be critical. And also looking at raising the age of sale, because the age of sale is a key proponent in encouraging young people, unfortunately, to start smoking. So the spending review actually failed to address the 25% real terms cut in public health funding since 2015. So reductions in spending on tobacco control have bitten even deeper by a third since 2015. So we need new sources of funding. The government promised to consider a polluter pays levy in the 2019 Prevention Green Paper when it announced the smoke-free 2030 ambition. Now, the All-Party Group has done the analysis, and we've estimated that in the first year alone of a polluter pays levy, £700 million could be raised. This would not just only benefit England, but the whole of the United Kingdom, and is more than twice the cost of the estimated cost of tobacco control measures which we're proposing tonight, which would then leave the government with further funding to spend on other health priorities. So the proposal is for a user fee. It's along the United States lines rather than an additional tax. And now we've exited the European Union and can set our own rules on this, the EU tobacco manufacturers' profits can be controlled. So they can't pass the cost on to the consumer. But what we can do is control their profits and use their profits for the benefit of preventing people smoking in the first place. Now, it's quite justified that we do tax the manufacturer's profits. This is the most highly addictive product which is legally available and then kills those who actually use it for the purposes to which it was intended. I give way to the honourable gentleman.
Yeah, the honourable gentleman refers to 2015 and public health, but is he also aware that in 2015 it was identified that 144.8 million on prescriptions, outpatients visits almost 900 million, hospital admissions almost 900 million, a total of 2.6 billion cost to the NHS as a result of smoking. Isn't it money well spent investing in smoking cessation?
I thank the honourable member for that intervention. And quite clearly, if you invest in public health, if you invest in smoking cessation, you're preventing costs in the health service later on in life. Well, the reality is that the estimates are that in the last 2 years of your life, you will consume most of the cost of health during your lifetime. And clearly, those individuals who suffer from cancer or other respiratory diseases caused by smoking, of course, will cost the health service dramatic sums of money. So actually, we are helping the nation to be healthier and indeed saving money for the health service in the long run. And now, to quote the CMO, the great majority of people who die from lung cancer, and I quote, die so that a small number of companies can make profits from the people who they've addicted in young ages and then keep addicted to something which they know will kill them. So the time has actually come to make the tobacco manufacturers pay for the damage that they do, not only to older people, but to young people in particular. We need to bring forward the day that smoking is finally obsolete in this country, and I regret that if we don't take measures, then that day will be lengthened quite considerably. But funding alone is not enough. And what we've got to consider is tough regulation. Now, since lockdown, and I think the honourable member for Central Ayrshire mentioned this, that we've seen a surge in smoking rates in young adults by 25%. So raising the age of sale from 18 to 21 actually reduced smoking rates in the 18 to 20-year-olds in the United States by 30%. So we could do the same thing here. And the reality is that the complementary measures that we talk about, obviously giving away tobacco products at the moment is not illegal, but just imagine, tobacco manufacturers may say, well, if we give the tobacco products away free, then we could encourage people to become addicted, and then they'll buy them, and then we'll lead onto a lifetime of smoking. That, we've got to break that chain of events and make sure that people don't do that. And obviously, I have a passion to ensure that women in pregnancy don't smoke. At the moment, that's one of the most stubborn measures that we have to overcome. Some 11% of women in pregnancy still smoke, and we've got to give them every incentive and every measure to ensure they give up smoking, and indeed that their partners give up smoking at the same time. That's something that I passionately support. Now, our revised amendment, New Clause 11, addresses the concerns that the government raised at committee stage about the review of the evidence. And I hope that the government will look at the evidence and consult and then adopt the amendment at this stage of proceedings. Now, the reality is that people start smoking at certain key points in their life. It can be when they're at school and their friends are smokers and they encourage them. They want to be part of the team and the gang, so they take up smoking. They may take up smoking when they go to college or university or start a new job or in a new social environment or at a dreadful time of stress in their lives. What we've got to do is make sure that they understand that if they take up smoking, they're shortening their lives and causing themselves damage to their health and indeed to the people around them. So I will indeed.
Following his argument closely, does he agree with me that there is an interrelationship between the issues to do with alcohol dependency that were being mentioned by the Honourable Member for Ayr Central and the issue of smoking? Because one of the things that comes out from a book called Alcohol Reconsidered by Leslie Miller and Catherine Kell-Clark is that once you look at the science, the alcohol reduces your inhibitions, and it's therefore more likely that you would smoke. And that the two, if we can have a culture of moderation in alcohol, we'd probably do better on smoking.
I thank my honourable friend for raising that point. And clearly, the fact that you could no longer smoke within a public house or indeed a restaurant has dramatically reduced the incidence of smoking, so that you have to make a deliberate decision to go outside and inflict your smoke on the outside world rather than on the people within the public house or the restaurant. And I think that's clear. And so, Mr Deputy Speaker, what I would say is this. We who support these amendments have obviously tabled them at committee stage. We've sought government support. We've debated them at committee stage. We've debated them at report stage. We may not be successful tonight. I understand we may not succeed tonight, but I give fair warning that these amendments, or in another form, will be tabled in the other place, and we'll see what happens, because we do know that in the other place there is very strong support for anti-tobacco legislation, not least, of course, when the regret motion in July 2021, when the Lords passed a vote of 254 to 224 on the motion to regret that the government had failed to make a requirement that smoke-free pavement licences be 100% smoke-free. So that's smoking in the open air. We're talking about measures now to combat smoking overall. And finally, Mr Deputy Speaker, let me just say, all the tobacco legislation, and if we look back over the years on the measures on smoking in public places, on smoking in vehicles when children are present, on standardised packaging of tobacco products, all of these have been led from the backbenches. Governments of all persuasions have resisted them for various different reasons. I suspect my honourable friend the Minister, who I know well, may resist them tonight. But we on the backbenches, who are determined to improve the health of this country, will continue to press on with them, and we will win, eventually, whether it's tonight, but it will become soon. I so support the measures that are proposed.
Geraint Davis.
Well, it's a great pleasure to follow the member